Yes.
Okay, so it's kind of set up. The main one we're going to focus on is the trigeminal nerve, cranial nerve 5. We talked about all 12 of them, but the biggest one is going to be cranial nerve 5. It divides into 3 different branches. We have the ophthalmic branch, the maxillary branch or division, and the mandibular. So this is the 3 of them. We've got sensory and we've got motor. So if you remember, the sensory gives you like a sense of feeling. It senses hot or cold, it senses pressure, just overall temperature, stuff like that. The motor actually divisions actually give them the ability to move. Think of a motor makes something move. So the motor root is efferent. Efferent, think of effort. It takes effort to move something. So efferent goes with the motor and it makes something move. This is a picture of the trigeminal nerve on slide 3 and where it comes through for orientation. This is the nose right here. So this is the front of your face. It's a lateral view. There's your teeth right here. And this is where the trigeminal nerve comes from the brain down to the facial area. This is the ophthalmic division up at the top. It's going to be up on the top. It's going to run toward the eye. This is the maxillary division right here in the middle. And then this is the mandibular. So you can kind of see the maxillary is going to go to the maxilla, mandibular is going to drop down and go to the mandible. And we'll see that a little more clearly in the next coming slides. So the ophthalmic nerve, or V1, it's division 1, is afferent for the eyelid, the conjunctiva, the lacrimal gland. So it's going to move up to the eye. The second division is the maxillary division. It's formed in the pterygopalatine fossa. That should be a word that should sort of come back to you from the skulls, when we talked about the skulls, in the skull fossa. It's formed, or it passes through the pterygopalatine fossa, goes through the foramen rotundum as it's on its way to the maxilla. It divides into several different smaller divisions. It goes to the infraorbital nerve, which passes through the infraorbital foramen. You remember the infraorbital foramen was like right here. I've got a skull. It's right here below the eye. It's this little hole below the eye. So that's where the infraorbital nerve passes through. And then you've got your anterior superior, middle superior, and posterior superior. If you think about those 3 words and you break them down, anterior is going to be the front, superior above. It's going to innervate the anterior maxillary or above teeth. The middle superior is going to innervate your premolar region, and your posterior superior, of course, your molar region. And then you've got your greater palatine and your nasopalatine. This is a picture of what it looks like in the pterygopalatine fossa. It forms a ganglion. Do you remember what a ganglion is? A ganglion is like where a large number of nerves all come together and they form like a ball of nerves. So in the pterygopalatine fossa is the pterygopalatine ganglion, or a place where the nerves meet. And they divide out. And this is a picture of how they split out. So you've got your ophthalmic or infraorbital nerve that comes off, and you can see right here, here's your infraorbital nerve. It's coming through the infraorbital foramen. This right here for orientation is your orbit, or the eye hole. And this right here is your nasal, or your nose. Oh, my dog just jumped in. Go away. Go on, go back out. So you've got this right here, and this is going to innervate your upper lip. So if you think about and picture where this hole is located, or your infraorbital foramen, your upper lip is not too far away. The medial part of the cheek is going to be right inside here, and the lower eyelid and the side of the nose. So basically this whole little area right here, where it passes through the infraorbital foramen, is where it's going to innervate. I'm going to pause you guys for just a second and chase my dog out. She thinks it's playtime. Come on. Out. Sorry about that. She's rolling around thinking that I was going to play with her. So back to this. So the IO nerve travels posteriorly or back through the infraorbital canal along with the infraorbital blood vessels, where it is joined by the anterior superior alveolar nerve. So if you look at this picture, you can kind of trace back. Here's the infraorbital nerve, and it's going to travel back where it's going to join with the ASA nerve right here. And this is the ASA, or anterior superior alveolar nerve, and they're going to join right there. I think somebody's trying to get back in here. So I'll let you read just a little bit more about the infraorbital. So we talked a little bit about the infraorbital nerve block. It's an injection that can be given where you would actually go up above the canine and keep traveling superiorly until you get to where the infraorbital foramen is. And you would actually deposit anesthetic right there at the foramen, and it would anesthetize the infraorbital nerve. Now, as we just talked about, all of those areas that the infraorbital nerve innervates, including the lower eyelid, the inside of the cheek, the upper lip, that would be kind of uncomfortable for a patient. They kind of don't like you to do that. It's a pretty, as you can see by that picture, the needle has to go in pretty deep. So it's a pretty big injection for you to give. We don't give those. I have never given one in my entire life, not intentionally anyway. There are times when you may accidentally go in a little bit too deep. The patient's face is smaller. You're injecting and you slide a little bit as you go in, and you end up getting them anesthetized in that area. And they will let you know because they're ILT and they have no control basically over the lower lid, their cheek, any of that area. Anybody have any questions so far? Okay. The next one, as we travel down the nerve, is the ASA, anterior superior alveolar. The anterior superior alveolar nerve goes down to the anterior maxillary teeth. So it's going to be the incisors and the canines. There's a branch on each side of the face that comes down. So when you are anesthetizing, if you're working on the right side, you're going to anesthetize the right anterior superior alveolar, and that will anesthetize up through tooth number 8. It innervates the pulp of the teeth. The ASA nerve also receives interdental branches from the surrounding periodontium, forming a dental plexus or nerve network in the maxilla for the region. So in other words, it also innervates the periodontium, so the gum tissue will get numb. The periodontal ligament will be numb. So that whole area around surrounding the teeth will get numb. It does not innervate the gum tissue on the lingual side, though. That would be the nasopalatine nerve. This is a picture on slide 14 that shows you the different nerves and what they innervate or what you anesthetize, basically. This right here, where this orangey color is, that's your anterior superior alveolar. And you can see it's the central incisor, the lateral incisor, and the canine tooth. But you notice it doesn't go on the palatal side. It's only on the facial side. So it includes the pulp of the teeth and the facial side. If at any time you have any questions, please chime in. Let's see, you can get something called crossover innervation on nerves. So what that means is that the terminal endings of the nerve will cross over each other. So if your nerves are coming down on your anterior teeth like this would be your right ASA, your left ASA. Sometimes they'll cross over like this. And so you'll be anesthetizing the right, but tooth number 9 is going to get numb. Or you're anesthetizing the left and tooth number 8 will get numb instead of tooth number 9. That's called crossover innervation. So just think of they cross over each other, like you're crossing your legs. It's not common, but it does happen. And you're going around with your Cavitron and you get to tooth number 8 and the patient's not numb at all. But you go to tooth number 9 and their tooth number 9 is completely numb. So usually what you would do in that case is just go back in and infiltrate tooth number 8 so that you can scale it. The ASA nerve also receives interdental branches from the surrounding periodontium. We talked about that already. This is a picture of the skull. This is the canine fossa. The canine fossa is just distal to the canine tooth. It's this indentation right here. The canine eminence is where the canine root sticks out. Hopefully some of these terms are starting to sound familiar to you. And you're going to give your injection right above the canine tooth. The middle superior alveolar is the next branch off. So if you follow this maxillary division here, here's the infraorbital, here's the ASA or anterior superior, and then this one is the middle superior. And you can see the middle superior is going to the premolar region. The middle superior, just like the ASA, is going to innervate the pulp of the teeth as well as the buccal periodontium. So in other words, the gum tissue, the vestibule in that area, the lip area kind of, and then, but not on the lingual. That's going to be the palatal side. The MSA nerve then ascends to join the IO, so they join together and they run along the lateral side of the maxillary sinus. So those nerves that run along the side of the maxillary sinus, if you have fluid in your sinuses, if your nose is stuffed up and you have fluid in your sinuses and your sinuses get a little bit swelled or inflamed, they can put pressure on those nerves and cause the teeth to be uncomfortable. So sometimes during allergy season, patients will come in and they will say to you, my teeth hurt. And, you know, you kind of ask more questions like which tooth, and they'll just say like, oh, all of them right up here hurt. So you know it's not likely all of their maxillary teeth are abscessing at the same time. It's more likely that they've got some sinus pressure going on and it's putting pressure on the nerves of those teeth. But you'll want to ask more questions and make sure that that's what's going on. Your middle superior is this green area right here, and you'll notice it's got your premolars and the buccal side. It does not have any innervation on the palate. Another thing to notice is that right here on your first molar, this yellow one right here, 3/4 of it, or 3 of the cusps, are yellow. they are innervated by the posterior superior alveolar. This one mesial buccal cusp is innervated by the middle superior alveolar. So if you are only doing scaling and root planing on their molars, you may still have to give an MSA because this root right here, this area right here, may not be numb if you just give a PSA. Does anybody have any questions about that? So then moving on, this is where you're going to give your middle superior alveolar injection. So if you look at that, where that needle is going, it's going up to the tip of the root of the second premolar. So right in here. And it's going to get this area right here numb. Then you've got your posterior superior alveolar, which is this branch right here. And you can see if you follow it down, it drops down to the posterior teeth. And the same thing for it. It's going to numb the same areas or anesthetize or innervate the same areas, the pulp of the teeth, the gum tissue. And here's the picture. It's the yellow right here. Now you'll notice again on that one, nothing on the palatal side. So here's a picture of giving the posterior superior alveolar injection. Right up in here is your infratemporal fossa. This is where your pterygoid plexus of veins is located. That's why you have to be very careful. You can see that the needle stops right about there. If you're first learning, sometimes you can go in a little bit too deep and you can get close or into that pterygoid plexus, at which point you'll cause a hematoma. Then we've got the greater palatine nerve, which also comes off of that maxillary division, and it's going to innervate the posterior hard palate. So in other words, the hard palate where your molars and premolars are. And there's a picture of your palate. So if you remember, this bigger hole right here is your greater palatine foramen.
I have a question.
Sure.
Did you say the greater palatine only does premolars and molars?
The greater palatine, yes.
Okay.
So let's go back up to that picture real quickly here. So here's the greater palatine, is this orangey area, this right here. And you can see it goes all the way back to the third molar and comes all the way up to right between the premolar and the canine. And it goes all the way to the middle of the palate.
Okay, thank you.
Let's see. When you're giving, this is a good picture right here on slide 32, where it shows the nerve and how it branches over toward the teeth. And then this is the greater palatine foramen right here, where it passes through. When you're giving a greater palatine nerve block, you're going to be aiming just above the patient's head's laying back like this. So you're going to be coming actually just above the foramen so that gravity pulls the anesthetic to the foramen. And it's very hard. If you feel your palate with your tongue, it's very hard tissue. It's hard to get. You have to use a lot of force to get that needle to go through that tissue. We don't generally do these in clinic. We do them one time, usually on each other for practice, just so we can say we know how to do it. But it's very rare in clinic or in private practice that you ever really have to do this. Usually the PSA and the MSA will anesthetize enough that the pulp of the teeth are numb, and so you can still go around and be okay. Then the nasopalatine nerve comes through the incisive foramen right up here on the palate, and it's going to innervate the palatal tissue from canine to canine. So just across the anterior part of the hard palate. You're going to aim right here for the incisive papilla when you give the injection, and you can see right here on the skull. I should have flipped this picture the other way, but you're right here is where your incisive foramen is. And this is a picture of this green area right here is where your nasopalatine nerve is going to innervate. Again, same thing with the greater palatine. The nasopalatine is one you normally won't give. It makes your eyes water. It makes you feel like you got hit in the nose because it does travel along the nasal septum in that picture. So since it travels along the nasal septum, when you give an injection, it makes it feel like you got hit in the nose. It makes your eyes water, that kind of thing. We do those in clinic just so that you can, or in anesthesia class, so you can get the feel of how it's done, but we almost never give those in clinic or in private practice. So let's see, then we've got the mandibular division, V3. It innervates all of the muscles of mastication, so it has an efferent part, gives it effort, makes it move. It innervates all of the muscles of mastication, and the sensory part innervates the the mandibular teeth. These are just some pictures that came out of textbooks you can look at later. Do you want to take a break now? Let's do that. Let's take a short break for about 10 minutes and come back at 9:05. Get up and stretch. Sound good?
Yep, thank you.
Okay, so let's get back to the nerves here. So the three divisions of nerves, V3 or mandibular nerve, V2 or maxillary nerve, and V1 ophthalmic nerve, all join together and form the trigeminal ganglion. So remember, a ganglion is like a collection of nerves. So the three of them together, those three divisions, form the trigeminal ganglion. They are both afferent and efferent on the mandibular division. So if you look at this picture on slide 47 at the bottom right, it shows you the face divided into three divisions. And so basically division 1, being the ophthalmic division, is covered up in here. Division 2 or maxillary division, the maxilla, and division 3 is this darker area from the mandibular division. There are lots of smaller branches that come off the mandibular division. There are two, there's an anterior trunk and a posterior trunk. The anterior trunk is formed by the merger of the buccal nerve. And so if you look over here, you can kind of see where it branches out. The buccal nerve is going to come out here. It goes through the buccinator muscle and it's going to innervate your cheek area. So these few next slides, this one is like an actual dissection. I don't like this one. If you look at the next one down, this is slide 51. It shows you the different divisions that come off of the mandibular nerve division. So you've got the buccal. Think of the buccal side. The buccal nerve runs down and innervates the buccal gum tissue and the cheek area of the posterior teeth. Only the posterior teeth. You are going to give a buccal injection when you are doing scaling and root planing so that you can scale this area, the buccal area of the posterior teeth, so the molars and premolars. It's a very easy injection to give. You just kind of pass your needle along the occlusal surfaces toward the ramus. And as soon as you enter, the needle goes in, you're going to hit the ramus right away. You're going to hit the bone, and that's where you're going to inject. And then you've got your muscular divisions or motor divisions that innervate the muscles. Deep temporal. So think of the deep temporal nerve. The word temporal is going to innervate the temporalis muscle. Temporal nerve, temporalis muscle. So you can easily link those two together. Masseteric nerve, masseter muscle. Lateral pterygoid nerve, the lateral pterygoid muscle. So think of the name, tells you exactly what it's innervating. So those are pretty easy ones. Then you've got the posterior trunk, which is your lingual and your IA. Those are very important ones for you to know. So this picture is a little hard to follow when it's this small, but when you're looking at it on your own or in your textbook, look very closely. You can see where the lingual division is going to come down and it's going to come to the inner part or the medial surface of your ramus, and it's going to innervate the floor of the mouth and the lateral side of the tongue. This is kind of that dissection picture again. I don't really like those. They're very hard to picture. It's the afferent divisions for the body of the tongue and the lateral surface of the tongue and the floor of the mouth. So in other words, when you are giving your injection and you you anesthetize your lingual nerve, you are going to anesthetize the lateral side of their tongue, the body of their tongue, and then also the floor of their mouth. And so normally when I'm trying to understand if a patient's getting numb, I'll tell them to take their teeth and just touch it on the side of their tongue and touch it on the other side. Does it feel different on one side than the other? And they'll usually say yes, Because if you say, is your tongue numb? Well, the side that's not numb, they can still feel, so they'll say no. So when you're actually anesthetizing a patient, you'll want them to say, is there a difference in the way the two sides feel? And, you know, usually they'll say yes. They don't say, oh yeah, one side's numb, but they'll just say yes, they feel different. That's what you want to hear. Somebody's trying to get back in again. So let's see. So here's a picture on slide 60 that shows like the divisions. You've got your inferior alveolar nerve. Your inferior alveolar nerve is the big one that you're gonna anesthetize. It breaks out to the mental incisive nerve right at the mental foramen. And then you've got the mylohyoid nerve that drops down to the mylohyoid muscle. Occasionally on some people, this mylohyoid nerve still has a lot of sensory when you anesthetize the inferior alveolar. And so the patient will still feel not anesthetized on their first molar. So you have to go back and kind of infiltrate the first molar. Here's a picture of what the inferior alveolar nerve innervates and how it breaks into the mental incisive. So you can see right here's the mental foramen. And then these are the mental incisive branches. The inferior alveolar nerve anesthetizes this big green area. So it does the lingual side, it does the buccal side, it does the pulp of all of the teeth on one side of the lower arch. It does everything except the buccal tissue right here. And that's going to be your buccal nerve. So this yellow is what the buccal nerve innervates. All of this green is your inferior alveolar. So your lingual nerve is part of your inferior alveolar. So when you give your injection for your inferior alveolar, you're going to go in and you're going to anesthetize all of this, and then you're going to pull your needle just about halfway back out, not completely, just about halfway, and you're going to catch the lingual nerve. And then by the time you withdraw, this entire area is going to start getting numb. Then you'll go back and you'll do your buccal injection, and then you've got the whole side of the mandible anesthetized. And it's pretty nice. I'm going to skip over some of these because they're just kind of repeats on the inferior alveolar. I want you to look at the pictures. You'll see here that the inferior alveolar nerve passes through the mandibular foramen. Do you remember the mandibular foramen is on the medial side of the mandible, and it's got the lingula right above it, and the mandibular canal is where it travels down. And you can just look at some of these. If you look at a radiograph, and Professor Bowles will probably show this to you, you can actually see the canal. When a person's going to have their third molar or wisdom tooth extracted, they usually will take a panoramic or a 3D scan to see exactly where the mandibular canal is and where the inferior alveolar nerve is, because they don't want to break that nerve taking out a tooth. If they break that nerve, you'll have permanent numbness. Here's the mental foramen. It's where the mental nerve enters. There's a picture of it, an actual dissection picture. That's a pretty good picture. I like that one. Your mental nerve anesthetizes or innervates the mental region. So it's going to be the chin, the lower lip, and then the premolars and anterior teeth on the bottom. The incisive nerve is basically in the same place. The incisive nerve, when we want to numb the pulp of the teeth, we would give a mental injection, or what we call a mental injection, and then we put pressure on it. And when the anesthetic passes through the mental foramen, it's going to anesthetize the incisive nerve as well. So we call it the mental incisive. And so there's just another picture. You'll learn all about this again when you get into local anesthesia. And usually Professor Ramos thinks when she starts this chapter that on anesthesia that you guys are going to know all of this already because you should have learned it in anatomy. And then she's kind of surprised at how much of it you didn't remember then and had to be kind of reminded. So she'll go over all of this again, but please try to learn it for this class. This is a picture of that mylohyoid nerve. And these slides came from the textbook, so basically they're most of the slides, or they're the chapter in a summary. That's why I'm skipping through some of them. The facial nerve. The next one we're going to talk about is the facial nerve. It's the other big nerve we really care about. It emerges from the brain and enters the internal acoustic meatus in the petrous part of the temporal bone. The main trunk of the facial nerve emerges from the skull through the stylomastoid foramen. So we already know that. And it gives off two branches, the posterior auricular nerve, which, as you can tell from the name, posterior being behind and auricular behind the ear. And then and a branch to the posterior belly of the digastric and stylohyoid muscles. The facial nerve passes through into the parotid salivary gland, but it does not innervate the parotid salivary gland. So that's important to know. It passes through this parotid gland, but it does not innervate the parotid gland. So the parotid gland is actually innervated by the glossopharyngeal nerve. And there's a dissection of it. You've also got your greater petrosal nerve, which is a branch off the facial nerve. It's efferent and afferent for taste sensation in the palate. So this part right down here where I circled, it's afferent for the taste sensation in the palate. And then you've got your chorda tympani, which is another branch of the facial nerve. And these are some pictures just of where the nerves travel. The thing we need to know about the chorda tympani nerve is that it's efferent nerve for the submandibular and sublingual salivary glands, and also serves as an afferent nerve for the taste sensation for the anterior 2/3 of the body of the tongue. Slide 91 is one that you should know. But this is kind of also going to be on that chart that you had that I gave you on Canvas. And it innervates the muscles of facial expression, which we already knew that from the muscles. So as far as why some of these are important, trigeminal neuralgia is something that you will hear patients have. It involves the maxillary or mandibular nerve branches of the teeth. It causes pain. You'll have patients that have trigeminal neuralgia. So it's like they get facial pain when they speak or chew, and they get like muscle spasms and stuff like that. It's not real common, but it's not uncommon either. And so you can read a little bit about trigeminal neuralgia. Another one that is affected by the nervous system is herpes zoster. So you've all probably heard of herpetic lesions. These are just some pictures, some slides. The rest of these are just like review slides. These are right out of your book. So if you've read the book, there's conditions that cause facial paralysis, such as a stroke. So many of you probably know somebody that's had a stroke. So facial paralysis, when the muscles of facial expression aren't told to do something. So in other words, the facial nerve tells the muscles of facial expression what to do. If the facial nerve is damaged, it doesn't tell the muscles to do anything. And so the patient usually just has like kind of no the just droopy side of the face. It doesn't do anything. They can't bring their commissures up to smile or frown or anything like that. Bell's palsy is another one. It's a form of facial paralysis. Bell's palsy can happen, or where I've seen it happen is in younger women, oftentimes like after childbirth. You can cause damage to the facial nerve when you're giving an injection. Not that common, don't worry about it. Cancerous growths, neoplasms can cause, because the facial nerve passes through the parotid gland, so patients that have had cancers or neoplastic growths in the parotid gland can have paralysis of the facial nerve. And then these are just some of the pictures that came from the book. I would look at some of these, find the actual pictures. You have those note cards in the back of your book, and see if you can trace some of these nerves. Your assignment that you have for this chapter that's going to be due basically does that. It traces the nerves for you. So you'll definitely want to know that. Does anybody have any questions on that? I know that it seems like a lot of information, but some of it's just kind of review from the other slide thing we did. I have another one on the trigeminal nerve. It's short, it's only 23 slides. It basically summarizes what we just talked about. But this slide right here, number 4, is a really good one to trace the branches from. So it shows you where these.
We can't PowerPoint anymore.
Oh, you can't see the PowerPoint?
No, we see you. It just went off.
Oh, well, let's try getting it back on here. Whoops.
Yeah.
Can you see it now?
Yeah.
Okay. So this slide right here, these are all on Canvas too, but this slide right here is a really good one to help you trace the nerve. So here's the ophthalmic nerve right here, or division of the trigeminal nerve. This right here is the ganglion. It's where the nerves all meet, or the divisions all meet, and you can see the ophthalmic division, V1, is branching toward the eye. It passes through the superior orbital fissure, and it stays up here toward the eye, and it does stuff up here. This middle branch is your maxillary division, and you can see it comes off and it branches to the infraorbital nerve, and right here is the infraorbital foramen, and you can see the infraorbital division, or I guess it's division, passes through that, and it innervates the side of the nose, below the eye, part of the upper or lower side of the nose, I guess, right in here. And then it also has the ASA division that goes to the anterior teeth, the MSA that goes to the premolars, and then the posterior, or the PSA, that goes to the posterior. And then you've got your greater palatine and lesser palatine nerves right here that are going through the greater palatine foramen and the lesser palatine foramen. So they're going out through onto the palate. There's another picture of that pterygopalatine ganglion right here. And this one I highlighted the maxillary division and pointed to all the nerves on that. So there's the ASA, and you can see where right here I circled what it innervates. The MSA innervates this area. PSA innervates this area. And we've got the greater palatine, does the palatal for the posterior hard palate. And the nasopalatine does the palatal part of the anterior hard palate. And you've got your mandibular division that comes down here. This is a nice picture to see. Passes through the foramen ovale. Does anybody remember where the maxillary division passes through? Which foramen? We should know this by now. Does the foramen rotundum sound familiar? So maxillary passes through the foramen rotundum, mandibular passes through the foramen ovale. And just as a little review here, foramen rotundum and foramen ovale. So now you can kind of see where those come through. On the mandibular, we have the anterior trunk, which contains the buccal. The buccal numbs the buccal tissue. This is what it looks like. And then you've got, coming off of that, your deep temporal nerves, your masseteric, and your pterygoid. And those are what innervates the muscles of mastication. Deep temporal, temporalis, masseteric, masseter, lateral pterygoid, pterygoid muscles. Then we've got the posterior trunk, which is formed by the auriculotemporal, lingual, and IA. So that's the part we want to worry about or think about, the lingual and the IA. And then we've got a picture here of what the IA innervates, this green area. Then we've got the mental nerve that passes through the mental foramen, innervates the lower lip and the chin area. The incisive nerve innervates the dental branches, or in other words, the pulp of the teeth. So the mental would innervate the lip and the soft tissue. The incisive innervates the pulp of the teeth. So if you are going to do scaling and root cleaning and you want to get the patient numb, let's say they're missing all their molars, and you're just going to be scaling and root planing the premolars and anterior teeth, you would do a mental incisive because you want the teeth to be numb and the tissue surrounding the teeth. Then you've got your facial nerve, emerges from the skull through the stylomastoid foramen. We all should know that by now. It has two branches, the greater petrosal and the chorda tympani. And these right here tells you what they innervate. And the facial nerve itself branches to the muscles of facial expression. And that's it. So this is a very helpful kind of a summary to look at. So when you're on Canvas and you're looking at these, the one that has 135 slides, I would page through those and look, just kind of read the text and look at some of the pictures. But open up that one that's 35 slides because that's going to summarize the trigeminal nerve, or 23 slides. That's going to summarize the trigeminal nerve pretty much for what you need to know. So we're going to, I'm going to have all of you take out a sheet of paper. Does everybody have paper nearby? So we're going to do a little activity here. Let me pull it up. I think I have it on Canvas. Okay, do all of you have a sheet of paper?
Yes.
Yes.
Yeah.
Okay, because this is an important thing for you to do. This is going to help you tremendously. A student told me about this and, oh, let me stop it for a second here. And once they told me about it, I've used it ever since. They said it helped them to learn what they needed to learn. Now let me make sure I'm sharing this screen with you guys first. Okay, can everybody see this YouTube screen?
Yeah.
Yeah.
Okay, so we're going to watch this and we're going to do this as we go along.
Is there supposed to be sound?
Yes, you're not getting the sound.
No.
Okay, let me see if I'm hearing sound. Let me see. And you have your sound on your mic, I'm assuming. Do all of you have your mics are on?
Yeah.
Yeah.
And you still can't hear it?
Yeah, I can hear you, but I just can't hear that.
Okay, so let's try this a different way. Can you open up Canvas?
Yes.
Okay. Do you have a column that says assignments? All right, here, let me get this out of here and I'll pull it into your modules.
No, we don't have the assignments tab.
Somebody's got a dog. Hold on a second. Let me see if I can get this over to your modules here. I copied the link and I put it in an assignment. I just didn't put it so that if you guys could look at it later too, but let me see if I can get it over into your assignment section here. We're in 7.1, right? Let's see, assignment. Okay, so look in 7.1 and there's one at the bottom that says assignment A. Can everybody see that?
Yeah.
Okay, can you open it? And it's got a link to a video?
There's a way, I just Googled it, that you can get the sound to share through this video if you play it with us.
Okay, that'd be perfect. How do you do that?
If you go to Teams and you look at it, there should be like an option in that bar and it says share.
Uh-huh.
You click that and then at the top of that right there on the bottom, it should have something on there that says share your audio.
Wait, go back to that. I'm sorry. I'm on this and I shared this screen.
So once you go to Teams, there's like that bar, right? Do you have that bar? If you go to like the share tray, there should be like a little dot right there that says like share audio.
Mine doesn't. It says open share tray.
Yeah.
Oh, include system audio. Okay. Let's see if I can get that to happen. All right, let's try that again then.
Yeah, we can hear it now.
Now you can hear it?
Yep.
Oh, thank you so
Hello
much.
there,
You guys are like a
YouTubers.
lifesaver.
So I have been doing research for about half of a day.
And you
trying
can
to
hear
figure
it now?
out the best way to
Yep.
remember the 12 cranial nerves. And I saw a drawing which I've changed up a little bit because it's easier to remember the way that I'm doing it. So here goes. Grab a pen, grab some paper, and we are going to begin. The first thing you're going to draw is the number 1. Okay? After you draw the number 1, you're going to draw 2 eyes. Inside of both of these, you're going to draw a 2, 4, and 6. After you do that, you'll draw a sideways 3, pretending that these are the eyebrows. and this is going to come out to be a face once you're done. After that, the next thing you're going to do is you're going to draw the number 5 down below the nose and around. So we're going in order. You see that we've already had the 6. So the next thing we'll do, we'll draw the 7. The 7 will come all the way down. This is going to be the outside of your face that we're drawing, and a backward 7 because you need to make one on both sides. Next thing you'll draw is a number 8, which is going to be our ears. Then you'll draw a tongue, and you're going to put number 9, number 10, and number 12 because there are 12 cranial nerves. Last thing you'll do, you'll notice we didn't do the 11, so you'll do the 11 like little arms off to the side. Now that we've drawn your whole little guy, I'm going to explain to you what each one of these means and what they do. First one, for the number 1, you do the number 1 for 1, nose. This is the olfactory nerve. This one is where your sense of smell comes from. And this one is also going to be sensory. There are 3 different types. You have your sensory, you have your motor, or you have the nerves that do both. The nose is only sensory. Next one we did the 2. So you have 2 eyes. Cranial nerve number 2 is your optic nerve. This is what you see with. This is your vision. So number 3, that's going to be your oculomotor. 3. This one here helps with movement of your eyeball. The following one is the number 4, which is still inside of the eye. This nerve is called the trochlear. This one also helps with eyeball movement. We're going to go ahead and go to the 6. 6 is called the abducens. It also helps with eyeball movement. Then there's the number 5, the 5 that we did all the way around. The reason why we did this so largely is because the number 5 cranial nerve is called the trigeminal. Tri meaning 3. So what the trigeminal nerve does, and also it is the largest nerve out of the 12 cranial nerves. So one of the things that it does is the one that goes up by your eye is the ophthalmic branch. It's sensory information from skin around your eyes. The second area of the trigeminal, and you may or may not need to know this for your exam, the second area is the maxillary branch, sensory information from skin in the upper jaw. And the third one is the mandibular branch, sensory information from skin in the lower jaw, and also motor information to lower jaw for chewing. Got it? Okay, moving on. So, already told you that number 6 is the abducens. I think, I'm not sure. This one helps with eyeball movement, just in case I didn't already say that. Number 7 is the facial cranial nerve. Number 7 also helps with the secretion of saliva and tears. This one is, let's see. So cranial nerve number 7 is both. Now I did skip over what the other ones do, but I will give you a mnemonic so that it will make it much easier for you to remember whether these nerves are sensory, motor, or both. And if you watch to the end, I will tell you that as well. All right, so the next one is number 8, your ears. Number 8 is called the vestibular cochlear cranial nerve. This one is for hearing and also balance. Number 9 on the tongue is your glossopharyngeal. That one helps with tasting. 10 is the vagus. Although it's on the tongue, it does not control the tongue, but it controls the thoracic and abdominal organs. That one is sensory and also it's motor. Now, number 11, the 11s that you see on the sides, the little arms. The 11 is called the accessory nerve. This one helps with swallowing. Number 12 is called the hypoglossal. It helps with tongue movement. Now, there's two mnemonics that I believe will help you remember once it comes time to take your test. So the first one that determines whether it's sensory, motor, or both, the mnemonic is, some say merry money, but my brother says big boobs matter more. This is supposed to say brains, but if something has a little bit, so kind of dirtiness to it, it helps me remember a little bit better. So, once again, some say merry money, but my brother says big boobs matter more. That means cranial nerve number 1 is sensory. Sensory, motor, motor, both. Motor, both. Sensory, both, motor, motor. That helps you to remember what these nerves do. Another mnemonic that I just created today, I was looking on the internet, I didn't see anything that I like, so I came up with my own. This one is to help you to remember the order of the cranial nerves. And when you're taking your test, you're going to flip it wherever you can, turn it around, because a lot of teachers and instructors let you write on exams, and you're going to draw your face and you're going to write this stuff out before the test even begins. I want it fresh on your mind. Look at it before your test and then write this down. So here's my mnemonic. On one occasion, tried to open my mouth and force vegetables, gross, vomit, and heave. Now you only had to remember 12, but just in case your instructor's like mine and your instructor wants you to remember the 3 different branches of the trigeminal, which are here. This is going to be your trigeminal 1, trigeminal 2, trigeminal 3. Well, I am going to remember them by these right here. If you do not have to remember those, then you can go online and you can look up different mnemonics for that. But this is what's going to help me. Again, with some practice, draw these, and then you're going to want to, I practiced just now before making this video. You're going to want to write out what these are and what they do, which I did here. Until you know these, and just also try to find a way to associate and remember them on your own. That was a failed attempt when I was trying to make my own. So if something you see, the way that it is laid out online or on YouTube.
Okay, I'm just going to stop it here. All right, so as far as the mnemonics, I did put, if you go on Canvas, I did put a couple of sheets on Canvas that have some mnemonics on them. I believe I have the one that has big brains matter more on there. And then, as I've told you, if you want to change the mnemonics to mean something more personal to you, you can add people's names or different things like that to help you remember. But as far as, I'm trying to see if I can find where it is. Okay, that's the study guide. Just so I can show you where I have them down. Some of you may have already looked at them. Nerve chart. Let's see if it's on the nerve chart. Yes, so on the one that's marked nerve chart, down at the bottom are the mnemonics that she was just talking about. There, one of them says, oh, to try and find very good vegetables is always hard. Goes through the nerves. And then the types, it says, some say money matters, but my brother said big brains matter more. That's the one that tells you the some means sensory, motor, both. This one is tells you the nerves themselves. So like hard would be hypoglossal, always is accessory, vegetables is vagus. So that will help you to remember the nerves. So basically, I think for studying for the test, most people have found that if they keep kind of drawing that face that we drew, helps. Let's see, memorizing those couple of mnemonics will help you. As far as memorizing what they actually innervate, if you draw the face and you write down the mnemonic and it says both, like trigeminal and it says both, then you should have an idea that you know it's going to innervate sensory to the teeth and it's going to innervate motor to the muscles of mastication. If it says both, that means it's going to do sensory and motor. So it's actually going to make something feel and move. If it just says sensory, it's just going to make something feel. But it won't make an action actually happen. So in other words, like for the olfactory, for the nasal mucosa, it's going to give it feeling, but the nasal mucosa is not actually going to do anything. It's just going to have feeling. It's going to have the sense of smell coming through it, the little nerve, olfactory nerves for the sense of smell. Same with the afferent on the optic. It transmits sight to the eye. It gives the retina the ability to sense light and dark and brightness and color and all that kind of stuff, but it doesn't actually do anything to the eyeball. Does that make sense to you? Hopefully, maybe. Anybody?
Yes.
Yeah.
Okay, so I would say that